We approach every case, at least as behavioral neurologists, we approach every case not as just the person, and not even just the dyad, meaning the person and the caregiver, as I said before, the ecosystem. Take into account where they live, where they're coming from, right? What the environment is, who else is in the picture, who else interacts with them. Sometimes you have paid caregivers, sometimes you have relatives, and all of them have something to contribute. All of them somehow are being affected, and all of them contribute to, make the patient's environment better or worse. So we work with all of them, and as I said before, this really tailors into a social level personalized medicine. We cannot give a canned product or a canned recommendation to improve the symptoms. We really need to spend time with people, and this is what makes neurology slow, right? Neurology is slow, but cognitive neurology is even slower because you really have to have these conversations. A lot of these needs don't emerge on the first conversation. You need to really follow up, and that actually creates some burden, right? We are interested in getting to know the families, but we have some pressure from the system to keep moving, to see more patients, to make it faster, but that's not how it works, or that's just ideally how it shouldn't work like that. We probably need more time. We probably need to have systems that support the use of more time to get to the families, to do follow-ups, and to use these emerging technologies that we're seeing. So if the system changes, I think we will be even better. But it's a crucial point to be able to partner with the families. And I'm basically voicing what we see as neurologists, but we are definitely not the center of care. We are part of a team, and we need behavioral nurses, we need physical therapists, we need social workers. Very important what the social workers are doing, because they are the ones who are surveilling the resources in the community. That we don't have time sometimes to be up to that changing landscape of resources, and there's a big team. So I think integration within the healthcare system to be able to interact with the families is also very important. Now we're seeing the emergence, this is another innovation, which is the emergence of care navigators. This is a strategy that has been very successful in cancer, for example, cancer care, where a person who is not necessarily medically trained is trained, it could be a college graduate, for example, is trained to interact with the families, and they help triage, they help connect people with the right resource within the healthcare system without necessarily the patient having to wait weeks until they can talk to their doctor, for example. So care navigators are being introduced. They're being introduced experimentally in dementia care, but now with the evidence, we're convincing ourselves that it's a good investment to have to enlarge the team with this very specialized elements of care that are the interface with the patients.